To perform a blood test through the safe set, first we need to make sure that all the stopcocks are open to the syringe. So I have a triple stopcock open here and a double stopcock open here. I will pull back on my syringe to withdraw 10 milliliters of blood. You will see that the blood freely flows from the patient into the syringe. And when I am at 10 milliliters, I will stop. Once I have done this, I will close the stopcock to the syringe while keeping the stopcock to the patient open. I will sterilize the access port. By rubbing it vigorously. And then I will take my vacutainer with the access piece on it, and I will stick it into the access port. If I am doing any blood test such as a Chem7 or a CBC or a coag panel, I will simply put my test tube into the vacutainer, and you will see that the blood is going into the test tube. Once I have my blood sample, I can do an arterial blood gas, for example. As we mentioned before, there are two different syringes that you might see in a clinical setting. I will go with this one for now. There are two ways to do that. The first way, if you're sure of your dexterity, you can take an arterial blood syringe. You can try to stick it on top of the little needle in the vacutainer and pull up to draw up a blood sample. You will make sure that there is no air in your syringe before sending it to the lab, and remember that it needs to go to the lab immediately. Once I am done with my blood sampling, I need to take off the vacutainer with the access piece on it. The way to do this is not by pulling on the vacutainer, because frequently it can get disconnected from your access. So what we do is we actually pull on the connector instead to withdraw the entire unit. Okay, so if you are not certain of your dexterity, another way to take an arterial blood gas is to take this piece separately and to put it on top. Oh, the syringe already has blood in it. And to put it on top of your arterial blood syringe. You can simply screw it on top, and you can access after sterilizing the site, and you can draw up the blood sample and remove it by pulling on the connector. Once you've done your blood sampling, what's left to do is to return the blood that we have in the syringe to the patient. We will do that by opening the stopcock and by pushing the blood back into the arterial line. This way, there is no blood that is wasted. And one final step is to perform a flush of the line once you're finished with your arterial blood sample. You may perform the flush by finding the arterial line on your transducer and by pushing down on the two white levels that are there.